Hello, welcome to the Healthy Pet Show. I'm Dr. Joe Gordon with Dr. Paige Wages, here to answer questions about your pet there at home. We're going to have an open line show tonight. We brought some questions, some email questions that we've received to talk about, but also we encourage you to call tonight and present your questions to us to answer. The number for you to call to be a part of the show is 996-6775. Again, 996-6775. That number's on the screen, so please pick up the phone and give us a call, and we'll be happy to answer your questions tonight. We also brought we did bring a couple little kittens, just to let you be aware that it is that time of the year for kittens again. And these two came in through, these are second chance kittens, is that correct?
That's right. That's little Lane and this is Rory.
Okay.
They came in today with a little bit of a fever, so
okay.
we're actually keeping them tonight. But
if you're in the if your home's looking for a new friend, this is the time of year to get a kitten.
That's
Cats
right.
are seasonal in their breeding pattern, so we don't typically have kittens during the winter time. But as the days get longer, they start to ovulate again, and we have these cute little critters show up.
That's right, and there'll be lots and lots.
Yeah. So these kittens are about 6 to 7 weeks old.
I think that's right.
And so just the right age to be adopted. And cats make great house pets.
They make great, and they're good. They're just good companions.
I know we have two in our house, and one sleeps on my bed, and one sleeps on my daughter's bed, and keeps our feet warm at night. So, but easy to take care of most of the time. So. If you're considering it, please look at the SPCA, look at Second Chance, other rescue groups that are out there that will have plenty of kittens available over the next few weeks. So, okay. So,
the other thing this season is that we're headed towards thunderstorms as they start to happen. I think we may have one tomorrow night.
Okay.
Is that some dogs and cats, but mostly dogs, have some trouble with thunderstorms, where they get a little bit scared. I experienced that myself for the first time Friday night. I was watching my friend's dog, and she ate through her crate and had some stool in my house. But I've never had a dog have that severe of a reaction before. Okay.
Well, storm anxiety can be a very significant event in your dog's life, and in yours if your dog has it. Having had a dog that was storm anxious, I know that if a storm came up during the night, the dog would wake me up, and Athena, she would wake me up and keep me awake until the storm passed, or I was able to get her to calm down. And during the day, if she was inside, she would try to get out. If she was outside, she'd try to get in. And so it is a very difficult thing to deal with. Counter conditioning can be done to try to condition them to the sounds. Crate training most dogs, although the dog you were taking care of didn't work.
She's a new rescue.
Yeah, most dogs like to get in a small dark area whenever there's a storm out there, and if we can get them away from the lightning, get them in a place where the sound's not as loud, they'll calm down quite a bit. And that's a step to take. And then there's also medications that can be used to help to control some of the anxiety. What's one of the recommended medications that you would recommend, Dr. Wages?
For most dogs, just kind of a short-acting medication called alprazolam is used. It's a mild sedative. It lasts about 2 to 6 hours, depending on the dog. It's strong enough to basically let them sleep through it. Okay. And it's short enough acting that they're not basically sleeping all day long. Yeah. So that's something to try. You can also try some melatonin has been used in the past. Right. Which is another option as well.
Yeah. So. And the alprazolam is nice because it is a true anxiety relieving medication. Right. But you do have to be there as the storm's coming up to give it. And the melatonin, I like it. That's what I use for my dog. It works in about half the dogs. You give 2 or 3 milligrams once a day. It's just over the counter. And it's nice because I could give it in the morning and go to work and be gone for the day. And in case a storm came up, it still had its effect on helping to keep her calm. So. We do have our first call coming in tonight. Let's go to our phone lines. Hello, you're on the Healthy Pet Show.
Hi, I've got a yellow lab, and I was noticing on her foot she was licking it the other day. She's been licking it kind of, so I checked carefully between, like within her paw and between her toes, and it's very compared to the other foot, it's much more red and brown, and it's actually lacking some fur on the inner side of one of her digits. And I was just wondering, you know, what you thought about that. Is that serious enough to kind of maybe we need to dry out that area, or what your thoughts were on that?
How old is your Labrador?
He's like a year and a half.
A year and a half, okay. Has she had licking or chewing problems in the past, like an allergy?
No, she hasn't. But we play ball with her a lot, and we don't have a yard big enough, so we run her on the street, and I don't know if that wears down her paws too much. But it seems to be in between the digits.
Well, certainly the in between the toes, I think, is a secondary effect of her licking excessively. What she's done is she's licked her foot and made it wet between the toes, and probably has gotten a moist dermatitis or moist infection between the toes on the foot. So getting it dried out would be a good thing to do. And it may be that she needs to be treated with some antibiotics, either topical, maybe even oral antibiotics if the infection is bad enough. I would look for an underlying cause, you know, to determine what started the licking. And you mentioned the running on the road. It may have been running on the road that she irritated her foot pad or cracked a toenail or something and started licking at the foot for that reason. So
okay. What's the best way to dry that out? Like you put some type of you apply something down there to dry that out?
Usually a powder type of product. One thing that a lot of times with these moist dermatitis is a yeast infection in between the feet, and so using an athlete's foot powder like Aftate or I can't. That's the one I use when I need it. So that's the only brand name I can think of right now. But there are other ones out there. They're all on the shelf together in the store. But either getting the powder or the spray would work too, because the spray has a drying property to it. Just spread the toes and spread it down in there. Spray it down in there, or puff the powder in there and get it to dry out. The other nice thing about it is that it does taste bad, so that dogs tend not to want to lick it once you've put it in between the toes.
Oh, I don't think anything tastes bad to my yellow lab.
Well, that is a feature of labs sometimes. They like to chew on everything. So
great. Well, thank you very much, and I love your show.
Thank you for calling. Okay. Bye-bye.
Bye.
Okay.
Well, there's a lot of allergies.
Yeah. Allergies this time of year is a very common thing. And but again, since this dog was not having other previous issues and just one foot, it sounds like maybe it was an irritant that caused her to start looking at the one foot.
Right.
But it is that time of year for allergies. Springtime, a lot of trees are blooming, grasses are starting to pollinate, and people have runny eyes and runny noses, starting to cough a little bit, those that have allergies, and dogs are starting to lick and chew, and also have runny eyes. This time of year we'll see a lot of dogs come in with runny eyes, and what it is, it's the pollen. This pollen's gotten in the eyes, caused irritation, and that's not necessarily an allergy, it's just the accumulation of pollen in the eye. And a lot of times those cases, if we just keep the eyes rinsed out, it keeps the eyes from being irritated, using something like artificial tears to rinse the eyes out.
Or just eye rinse as well.
Yeah.
But sometimes they can develop a little conjunctivitis secondary to having the extra runny discharge, is it'll actually get a little infected, and they will need a topical antibiotic.
Yeah. So if the discharge is looking yellow or green, that suggests the infection, and that's when you take him in to see your veterinarian.
Right.
Okay, let's go back to the phone lines. Hello, you're on Healthy Pets.
Yeah. I was wondering if dogs can have allergies.
Yes, they can. Go ahead, Dr.
Well, we were
Wages.
just discussing that they can. Yes, they can. They can have grass allergies, they can have pollen allergies, they can have food allergies, they can have all sorts of allergies. What is your dog doing?
Choking.
She sounds like she's choking sometimes.
Is it like a cough or a choke?
It's more like a wheeze, or like a coughing, but it's a wheeze almost.
Has it gotten worse in the last week or so?
No.
Okay.
Last month or two, yes.
Okay. What is I'm wondering if it's sort of like a snorting sound.
Yeah.
Okay, sort of like a. See if I can do this on the air. Is it sort of like crow sound, sort of like that?
Yeah.
Okay. All right. That's That may be allergy related. That is what I refer to as a reverse sneeze, and that's typically what's happening is in the back of the mouth, the roof of the mouth, which is a soft palate, is getting trapped on the epiglottis. Some dogs have a naturally longer soft palate than other dogs, such as the bulldog or Boston Terriers, pugs, and those get trapped very frequently year-round. Other dogs, only during certain times of the years when there's an allergen in the air, their soft palate swells a little bit and then it becomes trapped on the epiglottis, and the effort is to try to cause that soft palate to fall back in its normal place when they're doing the snorting. A simple trick to help get it to fall back down, the next time it happens, blow in the dog's nose to get it to swallow and see if it stops it. The other thing you do is try to rub the throat. Rubbing the throat will stimulate a swallowing response also. And when we swallow, our epiglottis, which is the flap that covers our windpipe when we normally swallow food, will go back to cover the windpipe, and then it'll come back up and hopefully fall down underneath the soft palate rather than getting trapped by it.
Okay, well, thank you.
Okay, thank you for calling. So, but that is a very common problem. Beagles also tend to have a lot of entrapment of the soft palate.
Little poodlies.
Little poodles, poolies.
Yep.
Yeah, poodles you mean?
Yes.
Okay. But again, allergies do cause those tissues to swell this time of year.
Yep.
And can result in a more frequent occurrence.
Yep. That's right.
So, let's go ahead and take one of our email questions that you've got. And
okay. This one is. My vet recently told me after doing a urinalysis that my dog has crystals in her urine and we need to check it again in 2 weeks. Said it had something to do with the pH level. Can you explain further, and could this occur when a dog has been stressed by moving from out of state into a new home and surroundings? Okay. That's a pretty loaded question.
It is.
And urine crystals they're formed when the pH of the urine is imbalanced. So you can have basic urine will actually form struvite crystals, and acidic urine, you'll see oxalate crystals, and the crystals can actually cause irritation, sometimes create stones, and then they can allow for bacterial overgrowth. So a lot of times the signs of a urinary tract infection, urinating more frequently, smaller quantities. Some dogs and cats get uncomfortable when they have it as well.
Okay. So how would you treat a case that has crystals?
Treating crystals, if they have struvite crystals, which are again in the basic urine, what you want to do is actually acidify the urine. There are foods made for that. The SD diet made by Hill Science Diet is probably the best option for that. Some dogs actually need to stay on a food to maintain that acidic urine called CD after the crystals are dissolved. So that would be one way. With oxalate crystals, again, it's a diet change. If there's stones, oxalate stones, however, you actually have to remove those by surgery. Okay. So.
Right. And there are other types of stones that could occur, and they're not as common as the two that you've mentioned. But again, if your dog or cat has crystals in the urine, it's important to treat as recommended by your veterinarian, and to follow up in a couple weeks. Right. To make certain that the crystals have resolved and that any infection has resolved. Right. Okay.
And then how about the question about it? Could this occur when a dog was stressed from moving?
Stress has a lot of impact on the body, and certainly if I'm stressed, I may not eat as well. I may eat foods different from normal. I know that when we've moved or traveled with our dogs, we tend to feed them things we shouldn't feed them when we're traveling, and that can lead to crystal formation. And then just the stress of being moved could weaken the immune system a little bit and result in bacterial infection.
And sometimes, more in cats, but in some dogs, they can actually get an inflammatory cystitis where the bladder just gets inflamed from stress, and then they act like they have a urinary tract infection.
And also the lack of the normalcy of the habits. If we're not going out and using the bathroom normally, or we're not getting to our litter box normally in the cat situation, then the longer we hold that urine in our bladder, the more likely it is that crystals are going to develop in the bladder and therefore form stones.
Right.
So just a reminder that we're having an open line show tonight, and the number for you to call with a question about your pet is 996-6775. We'll be happy to answer your question there. So, okay.
Would you like another email question?
Let's get to another email question.
This question is that my dog loves to tear up anything he can get a hold of, be it clothes, paper, food left on the counter, tissue paper, and anything else. How can I keep him from tearing everything up?
Well, first I would want to know is how old is the dog?
Right.
Okay, puppies are just little exploring machines. They're going to look at everything. They're going to smell it. They're going to sniff it. They're going to taste it, pull on it, and if it comes apart or resist being pulled against, they're going to pull harder. And so puppies are just very investigative, and even as they get older, our puppy is currently 10 months old, and
this is a Great Dane puppy.
A Great Dane puppy. Her thing recently is to pull on her beds, and she has torn up 3 dog beds.
Wow.
In the past month already. Fortunately, they were all old dog beds and not the new one, but still, she's destroyed 3 of them, along with several other things out in the yard. So puppies will be puppies are just being puppies, and so the way to control that is to crate them, pick up things that you don't want torn up, make certain that things that have appropriate toys to play with.
Right.
Now, the other thing could be separation anxiety.
Right.
You leave the home. Separation anxiety is when you leave for the day and your dog is anxious about you leaving and then becomes destructive while you're gone. And how can that be managed?
Crates, again, is probably the best first step. If a dog continues to have some anxiety, you can actually, there's medication for that that's recommended. So I would speak with your veterinarian about that. Training is probably the first thing to try first, though. With training, working with a trainer, getting the pet accompanied with a crate, or comfortable being in a crate when you're out of the house.
Okay.
And then if it's not working, then medication. So.
Okay. All right, let's go back to our phone lines. Hello, you're on the Healthy Pet Show.
Yes, I have a dog that just comes in heat right regular, and I mean like every couple of months, and I was trying to find out what I need to do about that, and maybe having her fixed at a place where it's not very expensive.
Okay. All right, so if she is coming in heat every couple of months, that is abnormal for a dog to cycle every couple of months. Normally dogs will only cycle every 6 months. Maybe 5, but on the average it's 6 months. So I would be suspicious if your dog is cycling that frequently that she might have a cystic ovary or some abnormalities on her ovary. And the way to fix it is, as you suggested, to go ahead and have her spayed. A spaying procedure is a ovarian hysterectomy, meaning we're going to remove the ovaries and the uterus at the time of the surgery so she will not have heat cycles again. And so most animal hospitals and veterinary practices do ovarian hysterectomies. You mentioned a low-cost program. The Wake County SPCA has a low-cost spay-neuter clinic out on near Pet Finder Lane, and they have a program that if you qualify, you could use that program. There's also a certificate program through the SPCA that you can purchase a certificate and then take it to participating veterinarians where they would honor their certificate for the cost of the surgery also.
Okay.
Okay, but I would definitely go ahead and have your dog spayed because it is what the symptoms that you're describing of the frequent cycles is abnormal and can lead to more serious disease if it's left untreated.
Okay, thank you for the information.
Okay, you're welcome. Thank you for calling. And one of the things that can develop from those repetitive heat cycles in dogs is a pyometra. And what that means is that the uterus becomes infected and filled with pus. And some dogs is subclinical. I actually had a patient today that was in for just a routine spay, had a pyometra, and fortunately the dog had not been ill, but when I discharged it and was talking to the client about the condition that I found the uterus in, she did mention that the dog had been very lethargic for the past several weeks, and so that was probably the early symptoms of the pyometra in that dog, and a good thing that we're doing the surgery today rather than later on when it's an emergency situation.
Right, but when they get sick, they get really sick.
Yeah, they can be extremely sick, vomiting, diarrhea,
Not wanting to eat.
not wanting to eat, and it really is a critical emergency. If we know a dog has a pyometra, they should be spayed immediately
Right.
rather than waiting.
Right.
So, just observing these two kittens here, they're sort of the epitome of opposites. You have the classic lap kitten here
Yes.
that just is wanting to sit still in Dr. Wages' lap, and then over here we have the one that is just playful and wants to explore everything. So they do have different personalities, and that's something, if you're looking for a cat, you want to try to match the personality to what you want the kitten to do. I mean, if
Right.
you want a cat that's very calm and quiet, you'd like
Rory's available.
Rory. Okay.
Yep.
And if you want something that's going to entertain you, so you can turn off the TV at night after
Stay
you
up
watch
all night.
after you watch the Healthy Pet Show, then someone like this little guy.
Right.
Okay.
That's Lane.
Okay.
We have
That's
another
good.
caller.
All right. Hello, you're on the Healthy Pet Show.
Hi, I had a question about my dog. She has what I like to call a leaky wee-wee. I took her to the vet a couple weeks ago because when she was sitting around the house, sometimes she would get up and there would be a little piddle spot where she was sitting. And we checked her for a bladder infection, and she didn't have it. And they checked her for blood work, and it all came back okay. And for the past about week and a half, I've been keeping a journal of how much water she's been drinking and how many times the incident has occurred. And I haven't checked back with my vet yet, so I thought I'd just get a second opinion from you guys. But she's had accidents about 6 times, and she's drinking, on average, about 6 to 10 cups of water a day. And I was just wondering if this was excessive, and if I should check back with my vet to maybe get a scan on her bladder or her kidneys, or if you guys thought that was kind of a normal amount of water to be drinking.
How old is your dog?
She is about a year.
Okay, and how much does she weigh?
She is 50 pounds.
50 pounds. So the normal water intake for a dog is 1 ounce of water per pound of body weight per day. So your dog weighing 50 pounds should be drinking about 50 ounces of water, which is
Okay.
6 cups. And you said she's drinking 6 to 8 cups, right?
Yeah, well, the low is about 6, but she goes up to about 10 or 12 sometimes.
Okay, up to 10 or 12. So the days that she's drinking 10 or 12 is certainly excessive. I would want to know whether those are days that she's more active, outside more, because if she's outside more, she's probably going to drink more. If she's
Right, okay.
out running around playing. If she had your veterinarian might be trying to determine whether she thinks she might have diabetes insipidus,
Right.
which is a condition where the body doesn't produce enough antidiuretic hormone, which is helps control the water balance in the body, and that is characterized by excessive drinking and
Urinating.
excessive urination. When your dog has her accidents, is she just leaking, or is she actually squatting and urinating?
She's just leaking. There'll just be a little kind of puddle on the couch or on the floor.
Where she was laying at?
Yeah.
Okay. So you mentioned a scan. That's a good thing, because
Right.
what would they be looking for with a scan, Dr.
Well,
Wage?
with an ultrasound, looking to see if make sure that the bladder wall is normal and that there's a good sphincter on there
Okay.
to help control it.
All right. And another thing might be an ectopic ureter. That's, the ureter is the little tube that comes from the kidney and feeds into the bladder. There's one coming down each side, and sometimes those aren't in the right place. And if they're not in the right place on the bladder wall, then you can end up with a leaky bladder, like what you're describing.
Right. It opens up farther down past the sphincter.
Right.
So
it's opening up more toward the urethral opening. The other thing it could be is you just have a dog that has a weak bladder sphincter,
Right.
and there are some medications that may help with that. And a couple medications would be phenylpropanolamine or
Just called
diethylstilbestrol would be the
Proline.
two that I would be thinking about.
Right.
That may help help tighten up that bladder sphincter.
Okay.
And so, yes, I think it's important to go back to your veterinarian and share the information that you've gathered, and follow through with the recommendations, because if it is, it may be an easily managed situation if it's just a leaky bladder with a weak bladder sphincter, or you may, if it's an ectopic ureter, that may be a surgical correction problem.
Okay, thank you very much.
Thank you for calling. Okay. Well, let's go back to our email questions and see while we're waiting for the, well, they're giving us the wrap-up sign, so we'll go ahead and wrap up for the night. We do appreciate all the calls tonight on our open line show and the email questions that we received. And if you have email questions for us, you can send them to jgordon@carefirstanimalhospital.com.
Or pwages@carefirstanimalhospital.com.
Either one. And we'll get them and we'll put them on our index and bring them onto the show with us. We do thank you for watching. Thank you for all those who called. And again, remember, it's kitten season. If you're looking to expand your family, they're out there waiting for you.
They say, come get me home.
I love plenty of cats. Big ones and small ones, short ones and tall ones. They all make me laugh. Cats, 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 cats. They're all I adore. Though I've got a million, I'd make it a trillion. There's always room for more. Cats, 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 cats. How I love a